work on this budget. And I do believe that this is a budget that this entire body can be proud of. I'd like to expand, if I might, just a little bit on Article 2 for the members and anyone else out there listening about the Article 2 section of this budget, which, as you know, is our health and human services arena. This proposal in front of you reflects the recommendation of our Article 2 subcommittee, which included Senators Deuel, Eltife, Hinojosa, Whitmire, Williams, and Zaffirini, all of whom worked tirelessly and passionately so that we could produce a product that tries to meet our responsibilities to those who depend on state services and to the taxpayers who expect us to ensure that state government lives within our means. And that was a very difficult task. The size and the scope of this section of the budget is amazing. It is also the portion of the budget that serves Texans who are in the greatest needs, the poor, the frail, and our most precious resource, our children. Senator Shapiro, I don't know which of us spent the most hours in those committee hearings, but we as a subcommittee, as yours did, I know, worked so hard to do what was right. And I want to tell you what we came up with, just some of the highlights. Our subcommittee spent weeks reviewing and discussing the cost savings proposals that are within our Medicaid program. We were able to identify almost $3 billion in savings, most of which resulted in creating a more efficient Medicaid program and actually improve the quality of care that our Medicaid patients will be receiving. After the subcommittee identified those savings, we reviewed the entire Article 2 budget. That included extensive conversations with the agencies and the stakeholders so that the subcommittee could determine what level of funding was absolutely necessary to provide a safety net for our most vulnerable populations. The overall Article 2 budget stands at $23.7 billion in general revenue and $57.7 billion in all funds. Each of you have gotten a copy of the budget in its entirety, but I want to go over some of the major items because I know some of you have heard some things. I want you to be clear in your minds about what we were able to do with this budget. Rate restoration. We hear a lot about that. Rate restoration was a priority for our subcommittee because we recognized the need to maintain an adequate network of providers to ensure that access to care would not be compromised. This bill, as amended, restores provider rates so that rather than the 30 to 40% reductions that would have occurred in the introduced version, we restore physicians, dentists, nursing homes, community care, rural hospital, and children's hospitals to current rates. Members, that's something you should be proud of and you should support. We also restored home and community-based services program providers to only a 1% rate reduction and immediate care facilities, the ICFMRs, to only a 2% rate reduction. Mental health was an issue that many of you came and talked to us about and said we cannot support the cuts that took place in House Bill 1. We want to restore the state resources that provide mental health services that really are the safety net for the recipients. Without these mental health programs, individuals are going to find themselves, we're going to end up paying for them in Senator Whitmire's criminal justice budget, or they're not going to receive the appropriate care and are going to be costing our state much more. This bill increases funding for mental health services to maintain current levels for community services, community hospitals, and state hospitals. Child Protective Services. Another area we prioritized was maintaining funding, Senator Uristi, in our Child Protective Services. Children represent one of our most vulnerable populations, and Child Protective Services is their safety net, and we were not going to do anything to diminish the strength of that net. This bill fully funds foster care, adoption, and permanency care assistance caseload and cost growth. It fully funds the 356 caseworker positions currently employed at the agency, and it also funds 100 additional caseworkers above and beyond currently filled positions. It completely restores the relative caregiver program. It completely restores the state's protective daycare program. This bill fully funds several programs at the Department of Assistive and Rehabilitative Services, including the Blind Children's Program, vocational rehab, comprehensive rehab, independent living centers, and autism. Those were all programs you all told our committee were very important, and we listened. We also increased early childhood intervention funding by $25.8 million, general revenue over the introduced version, to help the agency increase service hours to recipients. Talk for a minute about Department of State Health Services. This bill restores funding for several public health-related programs, including full restoration of substance abuse intervention, full restoration of HIV medications, partial restoration of tobacco prevention and cessation programs, and partial restoration of preparedness programs. This bill preserves all community care waiver slots and actually increases funding for nearly 1,000 additional slots through our Promoting Independence, Emergency Crisis, and Children Aging Out of Foster Care programs. I could enumerate, Mr. Chairman, to a much greater extent, but I'm going to conclude by saying we have made fiscally responsible decisions that will make our health and human services programs more efficient, less subject to fraud, waste, and abuse. And as I stated in the beginning of all this, our goal was to meet our responsibilities to those who depend on our state services, and I believe we're doing this, Mr. Chairman, and I urge all of you to support this Senate bill and what we're doing in this Article 2 portion of our budget. Thank you, Mr. President.